Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Welcome to the Friendly Pharmacist podcast, your go-to podcast for expert advice on managing your health. I'm your host, Nario Cantu, and today we're diving into a topic that affects millions of people worldwide, managing cholesterol. Cholesterol is an essential substance in our bodies, but too much of it can lead to serious health issues like heart disease and stroke. So, how do we manage it effectively? Well, let's break it down. It's important to understand that cholesterol comes in two main types, LDL, or low-density lipoprotein, and HDL, or high-density lipoprotein. LDL is often referred to as bad cholesterol because it can build up in the walls of your arteries, while HDL is known as good cholesterol because it helps remove LDL from the arteries. Now, when it comes to managing cholesterol, lifestyle changes are crucial. This includes eating a healthy diet rich in fruits, vegetables, and whole grains while limiting saturated and trans fats. Regular exercise is also key in improving cholesterol levels and overall heart health. But sometimes lifestyle changes alone may not be enough. That's where medications come into play. There are several types of medications commonly used to treat high cholesterol, and each works in a different way to lower LDL levels and reduce the risk of heart disease. Statins are perhaps the most well-known and widely prescribed medications for high cholesterol. They work by blocking the enzyme in your liver that produces cholesterol, lowering LDL levels. Statins have been proven to be highly effective in reducing the risk of heart attacks and strokes. The most common drugs are Zocor and Crestor. Another class of medications often used alongside statins is bile acid sequestrants. These drugs work by binding to bile acids in your digestive system, preventing them from being reabsorbed into your bloodstream. This prompts your liver to use up more cholesterol, leading to lower LDL levels. Example of these drugs are Questran and Welchol. There are also cholesterol absorption inhibitors, which work by blocking the absorption of cholesterol from the food you eat. This helps reduce LDL levels in your bloodstream, ultimately lowering your risk of heart disease. The most common drug of this class is Zetia, that has a once-a-day dosing. And let's not forget about PCSK9 inhibitors, a newer class of medications that have shown great promise in lowering LDL levels, especially in individuals with familial hypercholesterolemia or those who cannot tolerate statins. PCSK9 inhibitors can be highly effective for some people. Some research has found that these drugs can decrease your LDL cholesterol by up to 70%. They can cut the risk of a heart attack by almost 1/3. Of course, it's important to remember that medications are not one size fits all. Your healthcare provider will work with you to determine the most appropriate treatment plan based on your individual health needs and risk factors. We hope you found this episode of the Friendly Pharmacist podcast informative and helpful in understanding the ins and outs of managing cholesterol and the types of medications used to treat it. As always, if you have any questions or concerns about your health, don't hesitate to reach out to your friendly neighborhood pharmacist. Until next time, take care of yourselves and stay healthy.